Okay, next one is the T67 Eldoa. We talked about Eldoa, but it was quite a few months ago, so let me give you a refresher. Eldoa is a French acronym, and in the English language, it translates to load, L-O-A-D. L-O-A-D, the acronym is longitudinal, osteoarticular, which means of the joint. Longitudinal, think traction. Osteoarticular, think joint. Decoaptation. Coapt means to bind, stick, or fuse. So decoapt means unbind, unstick, or unfuse. So we are going to, through traction, unbind or unstick joints. We call that mobilization. That's what mobilization means. If you ever wonder what the difference is between mobility and flexibility, now you know. Mobility is of the joint. Flexibility is muscle tissue, tendon tissue, and even ligament tissue. Okay? So there is a particular Eldoa exercise for the very middle part of your thoracic spine, which is right about here. That when we open that up, it has a great influence on this posture, which in itself has great influence on shoulder, neck, and head posture. When I flex forward here, so if this is the apex of the movement right here, and I flex forward there, it changes all the curvatures in my neck, right? It changes the biomechanics of my shoulders. If you were to ever stand like this and try to lift your arms up as high as you possibly can, that's about as far as you would go. And I have pretty good shoulder range of motion, pretty good mobility of my shoulder joints, but not in this position. So a lot of people have shoulder issues. If we only look at the shoulder, we might be missing it. Because if somebody is told to hold something up over their head, but this is their posture, in order for them to go up any farther, they have to take their joint and pull it out of position with a heavy load. And you do that enough repetitively, say you're a construction worker, right? You're going to have shoulder pain. Your shoulder is compensating in terms of excessive motion for the lack of motion that's happening at the spine. So we see this, we go to see somebody and they say, oh, your shoulders are not flexible. We need to teach you a lot of shoulder mobility and shoulder flexibility exercises. Is that the case? What if we just stand them up straight? Did we just fix their shoulder flexibility mobility problem? Kind of. There really wasn't ever a shoulder flexibility mobility problem. But the function of the spine in this particular region dictates or governs to some extent the mobility, or what appears to be the mobility or the range of motion of the shoulder joints. Does that make sense? Okay, so head and shoulder very much related to carpal tunnel, tennis elbow. There's so many people diagnosed with tennis elbow that have never picked up a tennis racket. And it is very typical that it's coming from up here. So this particular exercise will have great influence on all other exercises. So here's what it's going to look like. Typically, you would sit cross-legged, and I'll demonstrate that for you in a second. But for now, I'm going to use this table. We start out with as long of a spine as possible. How do you make the spine long? Just the same way you'd make a rubber band long. You take one end and the other, and you pull them away from each other. Okay? So to make my spine long and then therefore flat, I'm going to take my tailbone and I'm going to push it into the floor. And I'm going to take the crown of my head, which is the very top of my spine, and I'm going to push it towards the ceiling. So whatever the postural distortion is, it doesn't matter. When you make it straight, you make it straight. So if you had too much curve here, this will make it straight. If you had too much curve here, this will make it straight. If you had too much curve up here, this will make it straight, right? It doesn't matter where the distortion is. This will correct it for this particular exercise. So it's a very straight spine. And if I reach up, you'll notice that my chin naturally tucks a little bit, like I'm trying to make a bit of a double chin. Make sense? So once I'm here, my hands are going to go on top of my head in a prayer-like position. Okay? Just like this. Not here, not locked. I know some of you are going to want to hold on for dear life. This isn't meant to be an easy, passive stretching exercise. And then once you're there, what you're going to do when you're in that posture is the elbows reach back, still trying to get as long as you can, and I'm going to reach as high as I can, to the point where it's as uncomfortable as possible. Not comfortable. This isn't a feel-good muscle stretch. We're trying to literally mobilize a specific joint in the spine, and that joint is thoracic 6-7 vertebra. Okay? So the reason that we position ourselves here is that if these are your vertebrae, right, which have this idea or this appearance, they look like bricks, and between the bricks is the mortar, and we call that the disc. And we're not so structurally built like that, but that's the idea for visual. Let's say that this is thoracic number 6 and this is thoracic vertebra number 7. What we want to do is position our upper body in a way that the fascia that attaches here is being pulled upward, right? To create a sense of lift on that vertebra. And then the way that we position the lower body is meant to create this sense of downward pull. These are supposed to be arrows. So that we can open up space, which means mobility, which improves shoulder mobility, neck motion, so on and so forth. If you were to sit like this and turn your head side to side as far as you can, it will be severely limited. If you sit up straight and turn your head side to side, it will be significantly, noticeably better. So this portion of the spine governs to some extent the motion of the shoulders, of the neck, even the jaw. If you're like this and I ask you to open up your mouth as wide as you can, it's not as wide as if it's here. Isn't that amazing? It's crazy. And when we look at most people's posture in our culture, we're like this a lot of the time, right? We're very front side of the body dominated. All of our focus is here. It pulls us in this position. So over time, let's fix it. So this is a corrective exercise to help solve the problem. Now, I sat on this table so you could see it, but in the actual exercise, in order to get the downward pull on T7, you want to sit cross-legged. We used to say Indian style. Now we say crisscross applesauce in elementary school. But you get the idea. You sit cross-legged. Some of you will notice this. You'll sit down in this position. You'll reach up here. You'll lift your hands, and your knees will come up with. Well, why does that happen? Because fascia is connected everywhere in the body. Everywhere. There's no beginning and there's no end to it. It's not like a muscle or a nerve. There's a beginning and an end. A fascia is a web that goes throughout all tissues of the body. There's no beginning and there's no end. Where does a spider web begin? Where does it end? It's the same idea. So if you pull on any one area of the spider web, it affects all others. Okay? So as you're reaching up here with your arms, you're also trying to push down with your knees, especially if your knees are coming up. Now here's what happens. Because you're all made to win, you all want to do a good job, and you all work hard, you put your hands in this position, and you oftentimes will compensate somewhere else to make that easier. Robbing Peter to pay Paul, so to speak. So you get in this position, I'm sitting cross-legged, I got a nice straight spine, I reach to bring my hands up, and my head goes forward. Why? Because it's way more comfortable, and we're meant to move in path of least resistance, right? But we don't want to do that. Priority number 1, flat, straight spine. So we stay here, and we get there as best we can. And this, for most of us, including myself, is very difficult because our tissues are not as compliant as we would hope. Why? Hydration, nutrition, ergonomics, all the things we talked about before. So once I'm here, I reach up as high as I can. And the goal is to get my fingertips up as high as possible. It's okay for the hands to separate, they will. But I want to go up as much as possible. This is not up, this is up and out. Up as high as possible means your arms are vertical. Most of you will find relief out here. So oftentimes I'll tell people, imagine you're trying to squeeze your ears with your biceps. Not here, here. Squeeze your ears with your biceps, reaching. You'll see the shoulder blades and the shoulders start to come up off the rib cage. You see that? So we want to get as much pull here as we can to create the least amount of compression. Now, if I were to stretch you, here's the really cool part about Eldoa. If I were to stretch you passively, it would feel really good and you get some momentary benefit. But when you do it yourself and you're forced to put the work in, your body will learn to a much higher degree and it will be much, much, much more long-lasting. Eldoa is really cool stuff. It is really advanced, and it is really new to the US. I got an email earlier this week. A guy contacted me, said, I understand you do Eldoa. I'm looking for someone to do Eldoa in the Twin Cities, and you're the only person I know that does it. And I'm the only person I know that does it too. But it's huge in so many other places. There's a lot of professional athletes from the States that fly to France and other places to have this form of therapy because it's so effective. People that are desperate for surgery have become no longer surgical candidates. That's not the end-all be-all. Nothing is. But it's what I'm trying to say is that it's super duper effective. Okay? So that's the Eldoa. So here's what it looks like. I'll sit right here. So you're going to cross your legs. Again, for some people, this is really hard. Don't be surprised if you start getting cramps in some areas, like the hip flexors is very common here, because your hip flexors are working to hold your spine straight. And your hip flexors don't have to work to hold your spine straight right now, do they? You got a backrest. Right? So when you ask yourself to hold your spine straight, it's like, well, I haven't had to do this responsibility much at all. And all of a sudden it gets really hard. So don't be surprised if it's hard. If it's hard, that's okay. Hard's fine. Sitting up as tall as I can. I'm going to put my hands up here. And I'm going to reach up as high as I can. And I can sit like this, which is easy. I can do this for 5 minutes. Or I can sit like this, which, if I'm in good condition, I could last maybe a minute. It's very difficult. Getting in the position, but then doing the exercise is a night and day difference.